Welcome. Today we'll be discussing about pernicious anemia. So pernicious anemia is a disease of the red blood cells. But before we begin our discussion, it's good that we remind ourselves where we have come from. So we have been discussing about the anatomy and the structure of the stomach and its function. So let us remind ourselves very quickly. So it started by saying that the stomach has got the cardiac region, the fundus region, the body, the pylorus region. So the regions of the stomach are the cardiac region, the fundus region, and the pylorus region, and the body. So we also say that the stomach has got fundic glands, which contain cells like enterochromaffin cells, enterochromaffin-like cells, parietal cells, mucous neck cells, chief cells, and parietal cells. So another thing that we said is pyloric glands. So pyloric glands contain cells like G cells, mucus cells, enterochromaffin cells, and enterochromaffin-like cells. So lastly, we said we have cardiac glands, and the cardiac glands contains enterochromaffin cells and the chief cells, and the chromaffin-like cells, and the mucus cells. So we also said that chief cells are responsible for production of various enzymes. One, pepsinogen. Two, renin. Renin, which is not found in humans, it's found in animals. We also said that urease enzymes and gelatinase are also produced by the chief cells. So to quickly remind you about functions of each of these enzymes, we'll begin with pepsinogen, which will be converted in the presence of hydrochloric acid to pepsin. Pepsin is the one responsible for curdling milk. So, and also it breaks down proteins into peptides. So you also have renin, which performs the same function as pepsin. We have lipase, which breaks down lipids. We have gelatinase. We have urease, which breaks down urea into ammonia. Now, ammonia is very toxic, so it will be absorbed into the blood and then directed into the liver, whereby it will undergo the urea cycle and be converted back into urea. So we also said parietal cells are the ones that produce hydrochloric acid and the intrinsic factor of Castle, which is very important in our discussion today because it is the one that is connected with the absorption of vitamin B12, and vitamin B12 is also known as cobalamin. So vitamin B12 is very important in the making of red blood cells or the maturation of red blood cells. So if there is a problem in the production of the intrinsic factor, so that will lead to pernicious anemia because vitamin B12 will not be absorbed, and therefore the red blood cells, which are also known as erythrocytes, will not mature very well. So you will have red blood cells that are megaloblastic. So we also have the mucous neck cells, which produce mucin, and G cells, which produce an hormone called gastrin. Enterochromaffin cells produce serotonin, and enterochromaffin-like cells produce histamine, which is associated with a wide number of inflammation reactions in the body. So let us begin our discussion about pernicious anemia. From our introduction, we said that pernicious anemia is a disease that affects the red blood cells. So a disease that affects the red blood cells, meaning that the red blood cells do not mature properly. Now, pernicious anemia is a disease in which not enough red blood cells are produced due to the deficiency of vitamin B12. And we have said that the deficiency of vitamin B12 can be caused by a problem in the parietal cells, which produces the intrinsic factor of castle. So the diseases that we looked about upon that can cause this problem, we said peptic ulcers can cause that. Uh, uh, we said surgery can cause it, cancer can cause it, gastritis can cause it. So, what are the symptoms of this pernicious anemia? Those people who are affected by this disease have a gradual onset of the disease. The most common symptom is feeling tired and feeling very weak. So if you often feel very weak and very tired, that is one symptom that you may be having or developing pernicious anemia. So you need an injection of vitamin B12. So now the other symptoms of anemia include shortness of breath. So shortness of breath here means that you have difficulty in breathing. So lightheadedness, you have also lightheadedness. Sometimes you have headaches. Sometimes you can have cold hands and feet. Sometimes you can have pale or yellow skin. Sometimes you can have chest pains and irregular heartbeat. So the digestive tract may also be disturbed, giving symptoms that include nausea, vomiting, heartburn, upset of the stomach, and loss of appetite. But you remember that not all of these symptoms one can experience. You can experience some of them, and sometimes pernicious anemia may go unnoticed for some few years. So, but the general symptoms that is associated with this disease is feeling very tired and very weak. So, what are the symptoms of vitamin B12 deficiency? So, the deficiency of vitamin B12 symptoms include the numbness, decreased ability to think, memory problems, blurred vision, trouble walking. You can also have poor reflexes and decreased smell and taste. You can have depression and confusion. Now, without treatment, some of these problems may become permanent. If you are not treated early enough, some of these problems that we have mentioned, some of the symptoms that we have mentioned may become permanent. So it is very important to go for a checkup and so that this disease can be eliminated earlier. Now, pernicious anemia, we have said refers to a type of vitamin B12 deficiency that results from lack of the intrinsic factor. And we said that this intrinsic factor is produced by the parietal cells. Now, lack of this intrinsic factor is most commonly due to autoimmune attack of the cells that produce this intrinsic factor. So it can also be occur following a surgery, and whereby the area that has got the cells that produce the intrinsic factor are being surgically removed. Now, blood tests may show fewer but larger red blood cells when you go to a test, but low number of young red blood cells and low level of vitamin B12 and antibodies to intrinsic factor may be shown in the test. Now, because pernicious anemia is due to the lack of this intrinsic factor, it is not preventable. So you cannot prevent yourself from getting pernicious anemia. This is due to lack of this intrinsic factor. So pernicious anemia can be treated with injections or pills of vitamin B12. Now, if the symptoms are serious enough, so the injections are the ones that are recommended. So we recommend that you take injections of vitamin B12 if the symptoms are very serious. Now, for those who have trouble swallowing, and there is also a nasal spray that is available of vitamin B12. Remember that this treatment may be needed for life because of the inability of the stomach parietal cells to produce this intrinsic factor. Now, pernicious anemia, due to autoimmune problems, occur in about 1 out of 1,000 people. Now, what we have discussed about symptoms and signs of pernicious anemia. Now let's discuss about pathophysiology of pernicious anemia. Now this will be our last discussion about pernicious anemia because we shall come back and discuss more about pernicious anemia. So, but I felt it is important now we have an introduction to pernicious anemia. So also this pathophysiology will introduce us to some of our topics that we'll be discussing in biochemistry. So the pathophysiology of this pernicious anemia is as follows. Although the ability of the body to store 3 to 5 years worth of vitamin B12 in the liver, the usually undetected autoimmune activity is one of the gut over the prolonged period of time. I'll repeat that point. Your body is able to store vitamin B12 for around 4 to 5 years in the liver. Okay? But the major problem that goes undetected is when your stomach is unable to produce this intrinsic factor. Okay, so you can have a problem with the production of the intrinsic factor, but your liver uses the stored vitamin B12 for around 5 years. So in 5 years, you can be having normal health, but you will not be having the normal absorption of vitamin B12 because of lack of the intrinsic factor. So vitamin B12 is required by enzymes for two reactions. So the first reaction is the conversion of maronyl-CoA to succinyl-CoA. So we'll be discussing about this maronyl-CoA and succinyl-CoA, but it's good that I repeat that point very well because I've seen that I've committed some mistake there. So there is two reactions that require vitamin B12. So the first reaction is the conversion of methyl maronyl-CoA into succinyl-CoA. And the other reaction is conversion of homocysteine to methionine. Conversion of homocysteine to methionine. Now, the maronyl group of the levofolic acid is referred to homocysteine to produce is transferred to homocysteine to produce tetrahydrofolate. This tetrahydrofolate, we shall discuss it more when we shall be discussing about biochemistry. And methionine, we shall also be discussing in biochemistry. So these terms like homocysteine, methionine, methyl malonyl CoA and succinyl CoA, we shall be discussing them when it comes to biochemistry. So this is just an introduction. So this introduction, this introduction we have said, vitamin B12 is required for conversion of methyl malonyl CoA to succinyl CoA. That's a point that we have to remember. Vitamin B12 is required for conversion of methyl malonyl CoA to succinyl CoA, and it's also required for conversion of homocysteine to methionine. Okay. Now, during vitamin B12 deficiency, the reaction cannot proceed. Okay. During the deficiency or absence of vitamin B12, these reactions cannot proceed because of what? The lack of intrinsic factor, which is required for absorption of vitamin B12, meaning that vitamin B12 will not be available for conversion of methyl malonyl CoA to succinyl CoA and conversion of homocysteine to methionine. You get that point? Okay. Now, since these reactions cannot occur, it will lead to the accumulation of levometholic acid. So levometholic acid will be accumulated in the system. So this accumulation depletes other types of folate required for purine and thymidylate synthesis. So the synthesis of purine and thymidylate synthesis will be impaired. Okay. Now, which are required for synthesis of DNA? So remember, DNA contains pyrimidines and purines. So the synthesis of DNA will be affected. Now, the inhibition of DNA replication in maturing red blood cells results in the formation of immature, large, and fragile megaloblastic erythrocytes or red blood cells. Okay? I don't know whether you have got the point. We have said the deficiency of vitamin B12 as a result of absence of an intrinsic factor will lead to the reactions of converting methyl malonyl CoA to succinyl CoA and conversion of homocysteine to methionine not to occur. So these conversions will not occur. Okay? Now, the deficiency of this vitamin B12 causes the reaction not to occur. Now that leads to the accumulation of levometholic acid. So levometholic acid will be accumulated, and this accumulation depletes other types of folates that are required for purine and thymidylate synthesis. So the accumulation of levometholic acid affects the synthesis of thymidylate and purine synthesis. So these two uh, uh, these two things that we have said, the purines and the thymidylate, are required for the synthesis of DNA. And since now DNA cannot be replicated as required, this will result to formation of immature, large, fragile, and megaloplastic erythrocytes. And this will lead to Pernicious anemia. So thank you for watching. I hope you have got a point, one or two. So I've tried myself to explain to you these terms or these things, but in the next upcoming videos, I'll be discussing more and more and more, and we'll understand as time goes by. So don't worry if you didn't get a point. I'll be repeating what I feel necessary, so that we can proceed together. Remember, this channel will be learning about, we have two sections. We have the medical section and we have the electronics section. So those ones who love electronics, we shall also be discussing more about electronics, but those who love medicine and fields that are related to medicine, we shall be discussing more and more. So feel free to ask any questions. Uh, I hope this video will help those who also want to know something about medicine and drugs and pharmacology and the rest. So let's meet in our next tutorial as we expand our knowledge. Thank you so much and be blessed.